Hi guys, how are y'all doing? We meet again and welcome back to Med Nuggets. Hope you watched our previous episode on menstrual myths, and if you haven't, go check it out. It's on Spotify, Apple Podcast, Amazon Podcast, you name it, it's there. And if you're not a fan of just listening to stuff, we've also made a video presentation of our previous podcast, which is uploaded already on YouTube, so you can check that out as well. Alright, so today we are going to talk about long COVID, and a lot of y'all guessed it right on our Instagram story. And we decided to talk on this because a lot of our non-medical friends and family, they're not aware of what long COVID is and how it has affected people's lives. Even though 65 million individuals around the world have experienced this condition called long COVID. And this is just the documented cases, right? There are so many other people who are experiencing long COVID and maybe not documented.
Yeah, actually, the CDC announced a few months ago that 4 in 5 people with long COVID are having trouble performing day to day activities of their life. And there are millions of people in the world who want to get back to work, who want to be themselves. So, this is not something that is just in their heads. This is not something that's just to get out of work or a disability scam. These patients just want to be themselves again. So this is a real problem.
Yeah, and so there are some groups of people who experience this long COVID symptoms more than certain other groups. I read that Hispanic and Black Americans, they're twice as more likely to have long COVID symptoms when compared to white and Asian Americans.
Yeah, actually, I watched this YouTube video a few months ago where a lady with long COVID is explaining her struggles. And she mentions in that video that she didn't receive any financial assistance from the Social Security Administration in the US. So she decided to create this group to connect with other people who are suffering from long COVID. And this group she created was able to gather over 13,000 patients suffering from disabling symptoms and who are struggling to find treatment and access to disability benefits. And she says that even after the President Biden had announced that long COVID would be considered a disability, and the CDC announced that 4 in 5 people with long COVID are having trouble performing day to day activities, still people like her are not able to qualify for disability in the US. So, this is the situation in the world now.
Yeah, so what these COVID recover patients are experiencing is something real, and they're not exaggerating. It's an actual condition that is affecting their day to day activities. So, our main purpose of doing this podcast is to raise awareness on what long COVID is and how it can affect a person's day to day, a person's life, basically. And to encourage people to empathize with them and give them the support and disability benefit that they rightfully deserve.
Yeah, actually, I read an article on the internet that said that as we try to move on from long COVID, as we try to move on from COVID, the people with long COVID, they kind of feel like they are being swept under the rug. So, I mean, these long term complications of COVID-19 have been described as the next public health disaster. Did you know that?
No, I didn't know that.
Yeah.
So now let's look at how long COVID has affected people's lives.
Yeah, we actually spoke with a few people, a few of our friends, and
Yeah.
some patients in our hospital, and asked them if they are experiencing any symptoms after their initial COVID infection. And these were their responses. Now, let's play the audio.
Yeah.
Yeah.
I feel myself weaker than before. I used to I'm very good at badminton, but now when I play sports for about 10 minutes or 15 minutes, I have to rest.
I mean, I don't know if I can pinpoint it down to COVID, but ever since COVID, I've had a lot of sleeping problems where I can't sleep. I wake up all anxious and I feel a little breathless. And this does not last for very long, but I do have these episodes every now and then.
Yeah, definitely. It's been about a year since COVID, but even to this day, I do experience some mental health symptoms, really, like feelings of depression, sometimes just lack of motivation or lack of inspiration, even lack of interest in stuff that I used to like. and I can't really pinpoint if COVID is the exact reason, but it did actually happen after it. And it's pretty tough because you still feel it even like a year, almost, it's been about even more than a year later. So
post COVID, I just feel breathless a lot, like, walking or running or climbing stairs. I get tired easily these days. It wasn't the same like back when, like, before COVID, like when life was normal, before quarantine, it wasn't this bad. And now also when I sit to study, I can't concentrate for long. My concentration, I feel, is the it's decreased a little. And that's it. I think breathlessness, like, I get tired a lot. Like, I just maybe travel to the hospital in the morning, and then by the time afternoon I'm back, it's like the day should end now. I can't function properly after that. So yeah, I get tired, and yeah, I can't concentrate. So
Okay, so I had COVID like 6 months ago, and since then I've been experiencing problems with my sleep. My sleep is often disturbed, and I'm like mostly like tossing and turning around in the bed. Sometimes even waking up in the middle of the night and not being able to go back to sleep again.
I am mostly okay. Even before COVID, I just had simple diseases like asthma and eczema, but it was well controlled and responded to medications nicely. But COVID, even now, post-COVID, I have found my asthma and my eczema have just worsened to such an extent that I am unable to sleep at night. I wake up asthmatic, unable to, breathe. So the doctors had to intensify my treatments, and just as I mentioned, I had asthma pre-COVID, but I guess it's worse now.
I'm not sure if this is really a symptom of post-COVID. But what I've noticed is when I run or do cardio for more than 20 minutes, I feel difficulties in breathing. Whereas before I was diagnosed, like before I got COVID, I was able to run like a good 1 hour without feeling difficulties in breath. But now I feel it really hard to go past 20 minutes. That is one of the main things I see which has affected me after COVID. Thank you.
I had COVID-19 last year, but even after recovering, I still experience joint pain and swelling. It started with my knees and then spread to my wrists and fingers. The ring I've been wearing for years suddenly wouldn't fit my finger. And sometimes I wake up with a shoulder pain with no obvious cause. The pain was so intense that I couldn't even get out of bed on some days. I tried everything from painkillers to physical therapy, but nothing seemed to work. Finally, after several months of suffering, I was diagnosed with long COVID. With the help of my doctor, I developed a treatment plan that included medication, exercise, and rest. It's been a slow process, but I'm starting to feel better, and I'm hopeful for a full recovery soon.
Yeah, so talking about the post-COVID symptoms, I was infected with COVID-19 in 2021 December. Since I've recovered, I've had this extreme sense of tiredness. Especially I've noticed this when I'm running in the morning, because I used to run usually up and down 4 kilometers, but now it's very hard for me to run 4 kilometers. Believe it or not, I barely run 2 kilometers, and I can feel that, that exhaustion. So it's very hard for me to do the physical work, and although this physical tiredness that I'm talking about, it's still I'm mentally stressed because of this, because I can't do my day-to-day life smoothly as I used to do.
Before COVID began, I used to cook a lot of food and try different and new things, but during COVID, I got it 3 times. And after I got it, I had a loss of taste for finer things, So I could not taste properly, and even after COVID, the taste has not been the same. I cannot taste like before, and most of what I eat are just plain food because I don't feel the taste like before. So after the COVID, there's been some side effects of it, and this is my major cause. This is my major problem.
So many people were telling me that after COVID they have like a lot of other symptoms and they didn't used to have before. For myself, I had like kind of stomach issues. I had problems with my digestion, and I think it got worse after the COVID. Like I used to have this problem first, but after COVID I was not able to eat very well, and whenever I was feeling hungry and I wanted to eat, I couldn't eat a lot, and I felt like nauseous, and I had no vomiting, but all the time I had pain in my stomach and very hard to digest food and everything. And also the cough didn't last longer. The cough was there for like 2 weeks, and the fever was gone in 1 week. But most of the time I was feeling that my body actually now it's much more, how do you say that, much more less energetic than before. I was feeling like no energy many times. I was feeling sleepy. I was feeling tired. And as I'm doing my rotation in surgery, I used to stand up for a whole day doing surgeries and a lot of surgeries every single day. But post COVID, I was not able to. I was feeling kind of sleepy and tired, and sometimes I just felt pain in my body, and I felt like I have no energy left to work with.
Now, this brings us to the most important question, which is what is long COVID? So, most people who get infected with COVID 19, like, I got infected with COVID 19, you got infected with COVID 19. I mean, we all felt better within a few days to weeks of our, infection.
Yeah.
But the thing is, for some people, these symptoms can last longer, and this is what we call long COVID.
Yeah,
Right?
and more specifically, WHO defines it as the continuation or development of new symptoms 3 months after the initial COVID infection, with these symptoms lasting for at least 2 months with no other explanation.
Now, the problem with long COVID is that there's no definitive diagnostic criteria to diagnose it.
Yeah.
I mean, can you imagine how challenging this is to the doctors?
Yeah.
Like not knowing how to diagnose a disease in medicine,
Yeah.
right?
So I think it's because it's specific to the symptoms that the patient is experiencing. Like if they are having a chest pain, then you have to do investigations specific to that, right?
Yeah, yeah.
So the first step for any physician is to rule out any other major health conditions by doing a total examination, by doing blood tests, chest x-rays, ECGs, and all of that.
Yeah, and actually studies have shown that some groups of people, they are more likely to be affected by long COVID than others. For example, people who have experienced severe severe COVID illness, like those who were hospitalized because of COVID or those who were admitted to the ICU, and even people who had certain medical conditions before getting the COVID infection, like people with diabetes or high blood pressure, these people
Yeah.
were more likely to get affected by long COVID.
Yeah, and also people who have not got a COVID-19 vaccine, they're also more susceptible to this condition. And also if people had certain multi-organ disorders, that it's affecting most of their organs or tissues while they're infected with COVID-19, these people are also more at risk of developing long COVID symptoms.
You mean people like arthritis and all
Yeah.
this, right? Rheumatoid arthritis
Yeah.
and all that.
All right, so now the main question that a lot of people have is, what is the mechanism behind long COVID? How is it causing these symptoms in your body, right? So
Yeah.
basically, in medical terms, the pathophysiology of long COVID. So a lot of research has been done on this topic, but they have not come up with one clear mechanism as of yet. So there are certain proposed mechanisms that researchers have come up with. So I will list down those proposed mechanisms. One of it is that the virus is able to cause a direct injury to your organs.
Yeah.
So for viruses or bacteria to cause damage to your body cells, it needs to attach to certain molecules. And if these molecules are present only in the heart, then it's going to damage your heart. If it is only present in your lungs, it's going to just damage your lungs. But the molecule that COVID-19 attaches is there in most parts of your body. So COVID-19 is able to damage a lot of your organs in your body. So it can damage your brain, your lung, your intestines, your kidney, and many more other organs. So I read that COVID-19 can cause damage to your brainstem. So brainstem is the area of the body that regulates your blood pressure, your breathing, your heart rate, sleep, and all of that.
Yeah.
So brain cells, when these get damaged, they cannot regenerate. We know that liver cells, they're able to regenerate, right? But brain cells, they cannot regenerate. So when they are damaged, this results in long lasting symptoms like anxiety, breathing, and sleep problems.
Yeah.
So this is one method by which COVID-19 can cause long-term symptoms, by causing direct injury to your organs. The second method is by causing your immune system to malfunction.
Yeah.
So what is your immune system? Just think about a Spider-Man movie, right? Spider-Man will protect the good human beings, right? And
From the monsters.
Yeah, from the monsters. As a monster is trying to kill the human world. So your immune system is like Spider-Man. They are supposed to protect you. But what COVID-19, the monster, does is manipulate Spider-Man to work for the monster and not for the humans.
Yeah.
Right? So it's going to produce, the immune system is going to produce molecules that will fight against the humans. That is, it will fight against your own body and not against the monster, which is COVID-19. Right? And also COVID-19 causes a decrease in these disease-fighting immune cells. So this makes you more prone to infections like bacterial infections, viral infections, even after you're recovered from COVID-19.
Yeah.
So that is another method by which COVID-19 can cause long-term symptoms. And also COVID-19, it causes an inflammation in your body, right? And if that inflammation stays for a long time, that's another way by which you can get long COVID symptoms. Like if the inflammation stays for a long time, it can cause symptoms like joint pain, fatigue, and muscle pains. So that's one method. And also, people who have a weakened immune system, like people who have HIV, people who have diabetes, or people who are taking certain immune suppressive drugs for certain diseases like arthritis, all these people, they have a weak immune system. So these people also can have the virus in their body for a long period of time because their immune system takes a lot of time to fight it because it's weak. So then also you can have long COVID symptoms. And also, even though a lot of people think that once you get COVID-19, you're like immune for COVID-19 forever, right? But that's not true. You can get reinfected 2-3 times. You can keep getting reinfected.
Absolutely.
So then also the virus stays in your body for a long time, and then also you can have long COVID symptoms.
Yeah.
And another interesting thing that I read was that COVID-19 will increase your chance of developing clots. So these clots can lodge in small and big vessels. For example, if it lodges in let's say your leg vessels, this can cause decreased blood supply to your leg, right? And this can cause pain in your leg, like calf pain, and it can even cause your leg tissues to die.
Yeah.
Basically call this in medical terms necrosis. And if these clots lodge in your lung vessels, this is a life-threatening condition called pulmonary embolism. You will have severe shortness of breath, and if you're not treated immediately, you can even die. So this is another method by which COVID-19 can cause long COVID symptoms.
Yeah. So now let's move on to the symptoms of long COVID,
Yeah.
right? So so far the most commonly reported long COVID symptoms are fatigue, things like difficulty concentrating, muscle aches, right? And even shortness of breath. So these are the most commonly reported long COVID symptoms. So because of the multiple neurologic symptoms that long COVID can cause, like loss of taste or smell, headaches, brain fog, right? Because of that, a lot of scientists and doctors like to call COVID a neurologic disease. Right?
Even though most people think it's a lung disease.
Yes. And also another thing that has gained a lot of traction these days is this PEM, post-exertional malaise, right? So this is something that a lot of people with long COVID are experiencing these days, right? So what is this post-exertional malaise? It is this feeling of exhaustion or difficulty to think straight that people experience along with a few other symptoms after a minimal amount of activity. So, for example, you and I, we are having a normal conversation right now, aren't we? So, and this is not making me feel tired, right? But the thing is, a person with PEM can feel tired and extremely exhausted even after having a normal conversation for just a few minutes, right? And it can last for days or even weeks, and we call these things, and we call these crashes, okay?
And some people with post-exertional malaise experience this cycle of push and crash, right?
Yeah, so what is this push and crash? Push and crash is actually this loop that a lot of people get caught in. It's this loop it's this loop of periods of overactivity and forced rest that a person is caught in, right? So to put it simply, this means when a person's symptoms are mild, they push through their symptoms by ignoring them and try to get as much done as they can. For example, you cook, you help your kids with their homework, you clean your house, you try to finish your assignments, you exercise, you basically try to do everything you can when your symptoms are mild. And this overexertion can actually worsen any long COVID symptoms you're experiencing, which in turn can lead to a forced rest or a crash, you know. So to avoid this cycle of push and crash, you can do something called pacing. Now, what is pacing? Pacing means you basically spread out your activities into smaller chunks with rest periods in between so that you don't overexert yourself and worsen your symptoms, right? And this idea of staying within your limits and avoiding crashes is what we call staying in your energy envelope, right? So the first thing you need to do when it comes to this whole energy envelope thing is you need to find your energy envelope. Right? Meaning you need to find the things that you can do and the things that you can't do. And then you need to track these symptoms in a book or a diary or even your phone or something, right? So for instance, if walking for 5 minutes makes you feel tired, you can jot this down in your book or a diary or something, right? But the thing is, you need to track your symptoms for at least 2 weeks in order to identify the things that you can do and can't do and what you feel after you do these things, right? So tracking down symptoms, it can help you find out how much you can do before you reach your limit and worsen your symptoms, right? The amount you can do without your symptoms worsening is your energy envelope.
And after you find your energy envelope, you have to adapt to that envelope. So basically you have to make a list of all the tasks you have to do throughout the day and divide them into the tasks that you must do and the tasks that are nice to do. I mean, it's okay if you don't do it, but it's nice to do it kind of task. And also tasks that other people can do for you.
Yeah.
And basically divide them into essential and non-essential tasks. And then you have to rank these tasks based on how important they are.
Yeah.
The most important on top and the least important at the end. And make a realistic schedule with rest periods in between. You can even share the workload with your friends and family, right? And the most important thing is to take a total rest period, that is to have some time with no screens, no phones, or no talking to people at all.
Yeah, I mean, have some me time, phone free, people free, screen free time, right? I mean, I always do that and I don't even have long COVID.
Yeah. And another thing is you need to change your environment and your posture, like go out a bit, don't always stay in your room, go out a bit and change your environment and your posture in such a way that you are able to do your task much easily.
Yeah, and now what you need to do is, after doing all that, expand this envelope, right? Which means now you can increase your energy envelope to include more activities without your symptoms getting worse. So don't increase your activities all of a sudden. Do it in small amounts and slowly over time so that you don't, so that it doesn't worsen your symptoms.
Yeah.
Right.
So another thing that a lot of people who have been infected with COVID complain is that they do not they are unable to have proper sleep, right? They have problems with their sleep. So we
Yeah.
call this insomnia, right? So it can be acute, that is only for a few days, or it can be chronic, that it can last for months and months after you've been recovered from COVID-19.
Yeah.
So this is another problem that a lot of people experience, and this can cause you to be cranky and less refreshed next morning, which is very frustrating, I think.
Yeah.
And also another problem is the loss of smell and taste.
Yeah.
So this is one of the symptoms that most people experience while they have been infected with COVID-19.
Yeah.
And while some regain their sense of smell and taste after recovery, some people will have it for a much longer period, like sleep problems. So even though it's not life threatening, it's still a big problem because you can't taste your pizza. So that's frustrating.
Yeah.
That can lead to depression, anxiety, and loss of appetite.
Yeah. So now let's move on to the next most important long COVID symptom, which is brain fog.
yeah.
So guys, actually brain fog is a term that has been there for a while, right? People can experience brain fog when they are sleep deprived or even during a migraine. So this is not like some new fancy COVID thing. We are just hearing about it more now because it's one of the more common symptoms of long COVID,
Yeah.
right? So what is this post-COVID brain fog? Actually, Dr. Preston Douglas, who is a board-certified neurologist, he describes this nicely. He describes this brain fog as a networking problem in the brain. Okay, he says that the coronavirus can directly injure the brain or even cause an overactivation of your body's immune system that can interrupt communication between different parts of the brain. And this can cause a mild inflammation in the brain that lasts for some time, which can, disrupt the flow of information in your brain, right? Actually, he describes this phenomenon with a nice example. I think the way I remember it, he compares this to a line of trucks that delivers goods that loses their central dispatch all of a sudden. And the packages will probably still be delivered, but perhaps not in the most efficient way, So in real life situations, it might take you more time to remember a person's name or a new phone number than it did before. So the information probably gets there eventually, but not as reliably as it did before you got infected with COVID.
And in one of the WHO articles, one of the doctors mentioned that short-term memory loss, brain fog, fatigue, these are all common symptoms among patients who have been infected with COVID-19. But there are several ways that you can do that can help prevent the stress and frustration that can result from short-term memory loss. Stuff like if you're more prone to losing, more prone to forget where you kept your key, then you can have like a fixed place where you usually keep your key.
Yes.
And to verbally remind yourself what is the next task. To tell yourself what is the next task, and to have mobile alerts, and to have a routine that is manageable, that is realistic. These are small things that can make a difference.
Yeah, and the good news is that most patients with this post-COVID brain fog, they recover completely in 6 to 9 months. But then again, there's that small subset of patients whose symptoms go on to last for up to 2 years, right? So if you are someone who is suffering from brain fog, I mean, what can you do to minimize your brain fog? That is the next question a lot of people, have, right? So if you're a smoker, quit smoking, If you're someone who drinks often, try to cut down. And also engage in physical activities. Any form of exercise will help, guys. Like even a 20-minute walk per day can increase blood flow to your brain and heal your brain tissues, right? And also eat a balanced diet. Try to eat healthy, because food like fast food, processed food, and sugary food, all these things can promote an inflammatory state in your body and work against healing. And also you can get the help of a dietitian, right, to make a meal plan for you.
I've also read that vitamin D supplements are also important.
Yeah, I mean, take vitamin D supplements once a day, because this can support your brain function, your nerve function, things like that. And just like you exercise or train your biceps, exercise your mind and memory too, You can do crossword puzzles, play card games, read newspapers, magazines, basically anything and everything helps, right?
Yeah,
when it
and-
comes to the brain.
Yeah. And if you're still having these symptoms for long periods of time, and if it's like disturbing your day-to-day activities, then you could always go to a doctor and get yourself diagnosed and treated, right?
Yeah. Now, another thing that a lot of my relatives and my family members they ask me is how can long COVID affect the heart? Can it cause heart failure? Can it cause heart attacks? These are common questions that I get, So, this US analysis of COVID patients after 1 year of recovery showed that they had an increased risk of heart diseases like heart failure, right? And MRI scans of the hearts of these people, they showed impaired heart function in 78% of people who had a prior COVID infection and in 58% of people with long COVID. So, yes, long COVID can affect your heart. It can cause things like palpitations, a high heart rate, and even chest pain, right?
Yeah.
So these heart palpitations are something that a lot of people experience, and according to a review I read the other day, it was a review of several studies that involved around 48,000 people with long COVID. More than 1 in 10 people experience heart palpitations. So this is a common thing.
Yeah, and also these heart palpitations can be caused by a problem in your autonomic nervous system, right? So autonomic nervous system is something that controls your heart rate, your breathing, and your blood pressure.
Yeah.
So this condition, we call this as postural orthostatic tachycardia syndrome. In short, it's called POTS. So it's normal for your heart rate to increase when you're having fever or when you're having an illness. So when you're having COVID, when you're infected with COVID, you can have an increase in heart rate. It's probably normal. But then if it is there even after recovery, this can be due to this problem called POTS.
Yeah.
So in that case, you have to speak to your doctor if you experience something like this.
Yeah, actually in the European Heart Rhythm Association this year, one of the research presenters, he mentioned that patients with severe COVID-19 who required the help of machines to breathe at some point during their COVID illness are 16 times more likely to develop abnormal fatal heart rhythms like VTAC, like ventricular tachycardia, within 6 months compared to people without severe infection. And also the risks of other heart rhythm disorders were also increased in this cohort of people,
Alright, so now since we're done with the cardiac symptoms, let's move on to the respiratory symptoms, basically symptoms that come because of damage to your lungs. So most people, when they're infected with COVID-19 also, they have breathlessness, they have cough, and even after recovery, they can still have cough and breathlessness, right? So this is another thing that a lot of people complain.
So what can you do to relieve these symptoms? Well, there are several practices you can do at home to help you, relieve these symptoms. For example, you can find a comfortable position, like sit on a chair and lean forward, or else lie on your side with your head supported on a cushion or something to help relieve your breathlessness, right?
Do
And
breathing techniques.
Exactly. You can also practice deep breathing techniques whenever you feel short of breath, like sit down in a relaxed position with your hand on your tummy. Then you can take a slow deep breath through your nose and observe your tummy rise up. Then you can slowly breathe out through your mouth and feel your tummy relax. So you can do things like this, to relax.
But we will upload a video or something on Twitter showing how to do these deep breathing exercises.
Yeah.
And another thing that a lot of people complain are gastrointestinal problems like abdominal pain, constipation, diarrhea, vomiting. These are also something that a lot of people experience after recovery from COVID-19.
Yeah. And also, like you said before, COVID-19 can damage our brain cells, right?
Yeah.
And this can, it can affect your mental health too because of this reason. So, also, most patients who have been admitted to the ICU or were connected to ventilation machines at some point during their illness, even these people were found to experience psychological issues because of this traumatic experience. Who likes to stay in the ICU? It's not a fun place, right?
It's very scary.
It's very scary. And also, at the same time, we shouldn't forget about the social and financial impact of COVID-19, right? Even this affected the mental health of a lot of people, And also during the Delta variant period, people were afraid to associate with people who have been infected and recovered from COVID-19 because they were afraid that even they could get infected as well.
Yeah.
Right? We call this the COVID stigma. So this kind of isolated these people and negatively affected the mental status of these patients. I mean, a lot of our patients tell us that COVID-19 has permanently scarred their life, right?
Yeah.
And so all of these things can cause problems like depression, anxiety, PTSD, and even short-term or long-term memory loss, right?
Yeah.
So, yeah.
How can you manage these symptoms now of these long COVID symptoms that we just mentioned, like sleep problems, cough, breathlessness, chest pain,
Heart
and anxiety,
palpitations, yeah.
anxiety, all of these symptoms? How can you manage them? You can do basically simple measures that you can do at home, like staying physically active and cutting back on things like caffeine, alcohol, and unhealthy food. And if you have sleep problems, you should track your sleep and write it down in a diary. It can be helpful for your doctor also. And get some natural light during the daytime. This has proven to improve your quality of sleep in the night. And just basically find ways to unwind, like meditate, do some stretching, and put out your negative thoughts in a diary, or tell your friends and family.
Yeah.
You know, these are certain stuff that you can do to manage your long COVID symptoms.
Yeah. And when should you talk to your doctor is another,
Yeah.
question that people have, right?
Yeah.
So if you have persistent symptoms of COVID-19 that are troubling you, affecting your activities of daily living, if you're experiencing a lot of, say, emotional stress, anxiety, depression, or any other changes to your mood and mental health, right? You can always go and talk to a doctor,
Yeah.
tell them about your problems and, yeah.
Because these problems, it can be because of COVID-19 virus, or it can be because of an underlying pathology that is not diagnosed, right? Some underlying disease.
Something dangerous.
Something dangerous. Can be some underlying disease that you never knew.
Yeah.
Right? So it's best if you're having it for a long time to get yourself diagnosed.
Yeah.
Talk to a doctor and get yourself diagnosed. Yeah, and how can you prevent long COVID? So that's the main question, right? So prevention is always better than cure. So always be protected from COVID-19, which is the main cause,
Yes.
right?
Protect yourself, protect others from becoming infected, right? And also the CDC recommends to stay up to date on COVID-19 vaccination. Research has shown that people who get a COVID infection after vaccination are less likely to report long COVID, right? Compared to people who are unvaccinated.
Yeah.
And also there was this study published in March this year that said that people who got two doses of COVID vaccine, they had a lower risk of long COVID compared to people who didn't get their vaccine, or people who only got one dose, right, one jab. So, and the other thing is, they also mentioned that 2-dose vaccination compared to no vaccination was associated with a lower risk of persistent fatigue and even lung disorders, right? So get vaccinated.
Yeah. There's nothing wrong with the vaccines.
Yeah, and also doctors and therapists, they can work with you to address your symptoms. Like, for instance, the Johns Hopkins post-acute COVID-19 team is this special multidisciplinary clinic that supports the recovery of people who have had COVID-19. And similar clinics are actually emerging even in other hospitals, right? Even in China, I think there are a few clinics that are emerging.
And there are several trials to test certain drugs and interventions for long COVID people who are experiencing long COVID. And I read this in an article in Johns Hopkins, and in their website I read that they're launching this new immune modulating drug that can help people who are experiencing POTS disease that we explained before.
Yeah, I think for more information you can go to the Johns Hopkins website and check it out. Yeah. All right, guys. So that brings us to the end of our episode number 2, which is about long COVID.
Yeah, and if you've not watched episode number 1, which is busting a menstrual myths, then please go have a look at it as well. It's on YouTube, it's on Spotify, it's on Amazon, it's everywhere. So go listen to it and support us, and also follow us on Instagram, Facebook, Twitter, YouTube. We're everywhere. So follow us, like, share, subscribe, and stay updated and stay tuned on our next episode.
Yeah, guys, have a nice day. Bye-bye.